For almost all of the last 16 months, 13-year-old Sophie, who has Down syndrome and other health needs, hasn't been able to go to school. She's one of 60,000 children who were told to shield during the pandemic, and with cases rising again, coming out of lockdown is just too risky.
All we want is for Sophie to be vaccinated to keep her safe, and I feel that all the clinically vulnerable children have been forgotten about. They don't get that our children, the clinically vulnerable children, aren't able to access school, aren't able to go to school. So you imagine the impact on their mental well-being, and they're falling behind with schooling, even more so they need it. And it's just isn't fair on the children, and it's not fair on the parents either.
The family are desperate for Sophie to have the Pfizer vaccine, which was approved for use in 12 to 15-year-olds a month ago. But like many other families with clinically vulnerable children left in lockdown, very few doctors are willing to give it before the government's Vaccine Advisory Committee, the JCVI, decide whether it should be offered. Sophie was told by her GP she could have it, only to be turned away at the vaccination centre. It means the long wait for a family reunion is on pause again.
I'm so grumpy. Because I miss Auntie Anne so much. I wish I could kiss and hug Auntie Anne better.
They need to consider, if they're not going to vaccinate all children 12 to 15 in the UK, then they need to vaccinate our vulnerable children so we can get back to some sort of normality, same as everybody else. People are cross about having to isolate for 10 days. We've had to do this now for a year and a half on and off.
The disability charity Contact estimate over 7,000 children are still shielding.
It's devastating. It's getting really desperate and really urgent for families that they get access to a vaccine for their clinically vulnerable children.
The government and the JCVI would say that they can't rush ahead with these things. They need to make sure that they're safe for children. Isn't that the right thing to do?
The UK regulator has said that it's actually safe for children over 12 and over now, so there's no real reason why the JCVI and the government shouldn't give the green light to thousands of clinically vulnerable children so they can, meet their friends, go to school in September, and their families. They've gone through so much over this pandemic, they felt forgotten, so it would really, give them the freedoms that we've all enjoyed.
You had a good day? Yeah.
The JCVI say they'll advise the government on vaccinating children and young people in due course. Until then, this is the only freedom Sophie gets, a few hours a week riding a horse outside. Only when she's fully vaccinated will she be able to go back to school, and the clock is ticking if that's to happen before they return in September.
Well, a little earlier I spoke to Lorna Fraser, a professor of epidemiology at University of York and a senior author of one of the largest studies of COVID risk, and Adi Caston, who's the daughter of a friend of mine. And I began by asking Adi why she was vulnerable to COVID and had been told to shield last year. Adi, what's your situation? Why were you told to shield last year?
I was told to shield because I have severe asthma and I've been hospitalised twice. I have viral-induced asthma, so I'm very vulnerable to the COVID-19.
And so are you sure that you want the vaccine?
I'm sure I want the vaccine because I want to feel protected when doing day-to-day activities, as right now I don't feel very safe seeing my friends who are currently at school.
But what's that been like? I mean, being separated from classmates and friends?
It's been weird since being homeschooled. It's nice because I've been able to get further ahead, but it's also had its limits since science is my favourite subject and I haven't been able to do practicals like I would have had to do at school.
And do you want to go back to school in September?
I would like to, but I would only like to if I can feel happy and safe going back.
And when you talk to your friends about this, what do they think? I mean, do they want to have the jab as well?
All my friends want to have the vaccine as well, and I don't think it's a problem for them.
Why? Because they're not vulnerable.
No, they're not vulnerable. I think they also just want to feel safer doing activities because I don't think me and my friends are burying our head in the sand about COVID-19.
Now, you're an athlete as well, aren't you?
Yes.
You're a competitive ice skater. So what has it meant for that? Have you had to stop?
Well, I have we were off for many months, and I'm trying to fit in 1.5 years of training into 6 months, as I have the British Championships in 5 months and the qualifiers in 2 weeks.
Oh, wow, OK. And so what do you think about those people who don't want the vaccine? Because there's a lot of them.
I think it's their choice, and lots of people want different things, and it shouldn't be forced upon them. It should be an option.
A lot of people are wondering why this decision is taking so long. You know, there are lots of European countries that have approved vaccination for children. America has, Israel has, Japan has. Why haven't we?
I think the JCVI are the organisation that need to make the decision, make the recommendation about whether we should be vaccinating children in the UK. So the data we published today have shown that children and young people are probably at even less risk of severe illness and dying from COVID-19 than we thought before. But I think as a society, we have to be very mindful of the sacrifices that these children and young people like Adi have done. So I would say if the JCVI are happy with the safety profile of the vaccine in children, and I know there is still some work being done by the CDC in the United States and by data coming out of Israel in order to help them make that decision, then I think based on the data that we have published today, which has shown that although the risk is very low, there is a slightly higher risk for children and young people with underlying health conditions and children and young people with more than one underlying health condition. So I think it would be perfectly reasonable to prioritise them for vaccination, assuming the JCVI felt that was safe. And I think Adi makes a very good point in that we should actually be asking the young people what they want to do.
Now, I mean, Adi's clearly got a very strong reason for wanting to be protected, but that doesn't apply to most children. And so for most children, we will be vaccinating them really because of the rest of us, because of the adult population. You know, what is the ethics of that?
So I think we haven't made any decision, and it may be that the JCV, I think what our data show is that it would be perfectly reasonable for the JCVI to recommend that children and young people with underlying health conditions, so those who are more vulnerable, albeit still low risk, should be vaccinated. It is a different argument, you're absolutely right, around vaccinating children and young people without underlying health conditions. And then there's obviously there's the benefit of that for the whole population, but there's also potentially the benefit to the children themselves and enabling them to be back in society, to doing the things they want to do. And Adi's given us a great example of her figure skating.
Well, let me just put that back to Adi. I mean, you were saying your friends want to be vaccinated. I mean, can you just explain why, given that they're not really at risk themselves?
Well, I don't think it's the problem of them being at risk, but it's also the problem of them wanting to feel safe. And it's hard because we're still not able to do as much as adults are doing because we feel that we're also being suppressed by not having the vaccine. And they do want the vaccine because I think they also want to be able to travel and see their families in other countries.
Well, Adi Caston and Dr. Fraser, thank you both very much indeed.